How to treat and cure diarrhea. Diarrhea will usually clear up without treatment after a few days, particularly if it's caused by an infection. In children, diarrhea will usually pass within 5 to 7 days and will rarely last longer than 2 weeks. In adults, diarrhea usually improves within 2 to 4 days, although some infections can last a week or more. Symptoms. Bad cases of diarrhea can come from a number of sources, such as the flu, antibiotics, food poisoning, a viral infection, contaminated water, certain kinds of surgery, a number of gastrointestinal diseases. Important ways to treat diarrhea. 1. Be sure to stay hydrated. 2. Try eating a bland diet. 3. Medications. Drink fluids. It's important to drink plenty of fluids to avoid dehydration, particularly if you're also vomiting. Take small, frequent sips of water. Ideally, adults should drink a lot of liquids that contain water, salt, and sugar. Examples are water mixed with juice and soup broth. If you're drinking enough fluid, your urine will be light yellow or almost clear. It's also very important for babies and small children not to become dehydrated. Give your child frequent sips of water, even if they are vomiting. A small amount is better than none. Fruit juice or fizzy drinks should be avoided as they can make diarrhea worse in children. If you're breastfeeding or bottle feeding your baby and they have diarrhea, you should continue to feed them as normal. Oral rehydration solutions. Your GP or pharmacist may suggest using an oral rehydration solution, ORS, to prevent dehydration if you're at risk, for example, if you're frail or elderly. ORS can also be used to treat dehydration that has already occurred. Rehydration solutions usually come in sachets available from your local pharmacist without a prescription. Children. The usual recommendation is for your child to drink an ORS each time they have an episode of diarrhea. The amount they should drink will depend on their size and weight. Your pharmacist can advise you about this. The manufacturer's instructions should also give information about the recommended dose. You may be able to give your baby an ORS if they become dehydrated, but check with your GP, pharmacist, or health visitor first. Eating. Eat small, light meals and avoid fatty or spicy foods. Good examples are potatoes, rice, bananas, soup, and boiled vegetables. Salty foods help the most. You don't need to eat if you've lost your appetite, but you should continue to drink fluids and eat as soon as you feel able to. They are dissolved in water and replace salt, glucose, and other important minerals that are lost if you are dehydrated. Hospital treatment. Occasionally, hospital treatment may be needed if you or your child are seriously dehydrated. Treatment will involve administering fluids and nutrients directly into a vein. Treating the underlying cause. If you've been diagnosed with a specific condition that's causing your diarrhea, treating this may help improve your symptoms. Irritable bowel syndrome, IBS, can be treated with changes to your diet and medications. Read more about treating IBS. Inflammatory bowel disease can be treated with medications that help reduce inflammation in the bowel. Celiac disease can be treated by excluding foods containing gluten from your diet. Read more about treating celiac disease. Bile acid malabsorption can be treated with medication that helps stop bile building up in the digestive system. Avoid certain foods. Dehydration from diarrhea can be fatal in young children and older adults. The most important thing you can do is to keep hydrated. Alcohol, milk, soda, and other carbonated or caffeinated drinks can make symptoms worse. Fried and greasy foods are off limits, and you should avoid fruits and vegetables that can cause gas, such as broccoli, beans, peas, corn, prunes, chickpeas, peppers. Dairy products won't help your diarrhea symptoms, either. Saccharomyces boulardii. Saccharomyces boulardii, S. boulardii, is yeast that works to restore your gut function. Acupuncture. Acupuncture may not be the first thing you think of when looking for a remedy for diarrhea. Scientists have seen positive results using acupuncture to treat acute diarrhea in children with cerebral palsy.